My name is Janet Corrigan, and I'm from the Washington, D.C. area of the United States. And my project is focused on building healthy communities. This project addresses a very, very important issue, not only to the United States, but I think to other countries as well. But in the U.S. in particular, we spend a disproportionate share of resources on medical care, far more than any other industrialized countries. And unfortunately, we do not achieve the kind of outcomes that we should for the investments in medical care. We have mortality rates for virtually all age groups, which are on the high side compared to peer countries. So what this project is doing is to focus on how we can engage communities and all stakeholders in creating healthier environments and healthier lifestyles for the population, because that's really the crux of our problem. I have for many years worked on the quality of health care, of medical care, the medical system. First at the Institute of Medicine for almost a decade, and then more recently at the National Quality Forum. And one of the things I've come to realize is that medical care is important, but it's only one contributor to the health of a population. Now, in the U.S., we have had many small-scale projects underway in communities to try to address things like environmental determinants of health. So things like air pollution or the need to have safer streets so that we have lower homicide rates. And there have also been many projects that have targeted obesity. So how do we encourage healthier lifestyles and better eating habits and more exercise? But in all honesty, those small-scale projects really have not moved the needle when it comes to a healthier population. They have a small impact in a very narrow area, and that just isn't going to address a problem of this magnitude. So what my project is doing, in the way that it differs from some of these earlier efforts, is that frankly it's focused on trying to take these earlier efforts to scale. How do we go into a community and set up a multi-sector enterprise that will engage all the different stakeholders in the community in creating a healthy community. And this, we think, will have much greater potential for impacting the health of the population over the long run, rather than putting more dollars into medical care. So it's different in that I've spent my career really on the traditional health care system, and this is getting outside of those boundaries and reaching into the community where people live and work to try to change their lifestyles and engage everyone in creating a better environment. Bellagio gave me the space to be able to tackle an issue of this significance and to really think very deeply about the kinds of solutions that might be out there. But the second thing that's been sort of unique about Bellagio is that it provides an opportunity to interact with people from very different backgrounds. And I found that there's a lot that I can learn and a lot that we have in common. So for example, I learned from some of my colleagues here that protecting human resources really isn't that different than protecting natural resources. And that we need to think about protecting the human population, which really is a public good. That's what determines the productivity of our workforce, whether our children succeed in school, whether there's good civic engagement. And we need to protect it in the same way that we protect natural resources, whether it's fisheries or it's grazing lands. The human population is a public good, and everybody has a responsibility to be a part of the solution. I also had the opportunity to interact with some wonderful artists here, and I think I came to appreciate how art can help us sort of win the hearts and minds of the population in our communities and to engage them in healthier lifestyles, and also help them better understand why they have such a high stake in creating healthy communities.